know that the beginning is the most important part of any work, especially in the case of a young and tender thing. For that is the time at which the character is being formed and the desired impression is more readily taken. Shall we just carelessly allow our fellow Filipinos to just mere see and hear casual tales, which may be devised by casual persons, and to receive into their minds ideas for the most part the very opposite of those which we would wish them to have, when in fact the government can do something about it on top of a legislative will aimed at strengthening the delivery of any social good? The DOH cannot. The ITRMC cannot. We cannot. Anything received into the mind substantiated with facts is likely to become indelible and unalterable. And therefore, it is most important that the tales which this so-called Juan de la Cruz, first here empowered by a medical powerhouse, should bring about measures to excellent delivery of health services, supported by a formidable government institution such as the Department of Health, with mandate of virtuous thoughts, in the continuous quest for freeing the people to health inequalities and social exclusions, inadequate and uneven response of health systems, and the continued search for servant leadership to move away from the ever-increasing bureaucratic interplay, bringing an increased rate in technical challenges brought about by political problems and obstacles. Then will our fellow Filipinos dwell in a land of health, amid fair sights and sounds, and receive the good in everything, and beauty, the effluence of fair works, shall flow into the eye and ear, like a health-giving breeze, and insensibly draw the soul from the earliest years into likeness and sympathy with the beauty of reason. In 2010, the DOH Administrative Order 2010-0036 on achieving universal health care or Kalusugan Pangkalahatan was signed and directed implementation of strategies to achieve better health outcomes, financial risk protection, and responsive health system that ensures equitable access to quality health care for all Filipinos, especially the poor. Strategies and human resources for health include availability of adequate competent healthcare providers at all levels of care. Yet in spite of the several reforms introduced, poorly equipped hospitals and poorly staffed local health facilities are still the two identified challenges that lag the full swing attainment of the very objective of this program. province of La Union, subjectively, there have been better deliveries of healthcare services as perceived by many, and along with availability of medical specialists that man almost all district hospitals, together with medical officers as frontline physicians, there still have been noted physicians who had not been into residency training. This now poses an arguable and debatable issue in the quality of healthcare as far as competencies are concerned. There also had been some arguable issues regarding district hospitals referring patients to ITRMC, and at some point receiving complaints that receiving physicians, who most of them are undergoing specialty trainings in their own respective fields, they have been dubbed as notorious in terms of behavioral conduct towards medical officers on duty, from referring district hospitals that even led to administrative disputes. With no baseline study at hand, there had also been several cases which can be managed in their own respective district hospitals that had been referred to ITRMC for treatment, hence giving rise to more hospital expenditures, and can also be presumed to giving rise of a bigger volume of patients that can be easily managed by district hospitals referred to a tertiary hospital despite the good facilities that are made available in all local district hospitals to date. This now projects a concentrated financial burden to both the ITRMC and the patient's resource. But insofar as ITRMC is concerned, the institution, despite of all criticisms being made, which can also be similar to any DOH-retained hospitals at that, as a service-oriented DOH hospital, the institution is more than prepared to catering and to attend the needs of these identified cases. There also can be an economic impact to patients and families who are referred to this institution. The mere fact that they have to travel all the way from point of origin to our institution entails financial expenditure. Notably, expenses may be trimmed down when these patients are handled and managed competitively in the nearest district hospital. Relative to this, some experts even showed the increased financial burden to patients who are being handled by specialists. Hence the proposal to shifting management from a specialist to a generalist, and that confidently, the generalist knows when to refer properly to a specialist. This shift can be excellently assessed when proper training of a generalist is done as primary healthcare physician, the most recommended training of which is the Community and Family Medicine Training Program. In this manner, the patients now will be able to save money without due compromise to the care they receive, and noting the family as primary healthcare support provider and involving community assessment to further understand the economic impact as well as the needed community intervention to buffer such negative impact identified. There also have been studies that would show that health impact is directly proportional to the community they belong. Healthcare providers, therefore, should see the holistic approach in the proper care of a sick patient so as to buffer relative and related risks to the community the patient belongs. With this, there is now a wide trend to shift the care approach from an individual to a wider perspective, the family, and it can be done the community as a whole in the management of diseases. Curative level of managing patient can also be very costly. The shift now also include the preventive aspect of level of care, and this can only be efficiently done when a community assessment is integrated in the said aspect. With these identified local and national issues in the healthcare system, the universal healthcare being proposed by the DOH has been reformative. Programs have revisited, and with the different proposals in the attainment of its very objective, Our institution now would want to establish a residency training that would further strengthen these objectives under the above-mentioned program. With the coming proposal of the PhilHealth system, one of the gatekeepers identified and still being prepared would be the community and family medicine specialist, along the general internal medicine and general pediatrics. Therefore, establishing a community and family medicine residency training program can fill in the gaps of these identified local and national issues in the delivery of healthcare system. A DOH draft policy under the AO 2010-0036 dated July 31, 2013, entitled Policy and Guidelines on Establishing or Expanding Family Medicine Residency Training Programs in DOH Hospitals and providing guidelines, approaches, and resources needed to establish the same in DOH hospitals and affect and influence the manner by which other stakeholders, including LGU and professional societies, shall behave and transact with the DOH in matters relevant to the program. Our Dynamic Medical Center Chief, Dr. Francisco Valdez, started to create a task force together with his able arm, Dr. Unity Cortez, our CMPS, Dr. Cherry May Poxidio, our Assistant Training Center Chief, Ms. Virgie Casuga, our Administrative Officer, and Ms. Maribel Flores, our HR Officer, come up with a development strategy plan and a structural framework in conceptualizing the implementation of establishing this program in ITRMC. With these developments, Dr. Valdez outsourced personnel to come up with a proposal to categorically prepare the development plan. Dr. Marvin Munar, yours truly, and then former resident of the Department of Surgery at this institution, having a good exposure with the same family medicine training program of the other hospital, started coming up with a plan. Ms. Maribel Joven, the current Strategic Planning Officer of the Commission on Population Region 1, a cousin of Dr. Munar, started to come up also with a strategic plan out of a casual conversation. Simultaneously, a constant pre-consultative meeting have been initiated with personalities from FEU and RMF, where Dr. Munar graduated, started coming up with a sustainable program. Also at that time, Dr. Valdez has also been full hands on coordinating with the CHD Region 1 office for technical advice in coming up with administrative support plan to ensure administrative support in place once the proposal will be finally accepted. Finally, with the support given by the CHD Region 1 and the final approval of the then draft policy tagged as Department Order Number 2013-0171 dated December 5, 2013, hence the implementation. An approved proposal dated January 10, 2014 through series of consultative meetings with the Assistant Regional Director, Dr. Benito F. Arca of the CHD Regional Office 1, this tripartite agreement, an advisor in fact, and similarly an agreed proposal between the FEU and RMF, authorized staff and attended by the FEU and RMF President, Attorney Antonio Abad Jr., and the ITRMC panel during series of pre-consultative meetings dated December 10, 2013 and January 16, 2014, held in FEU and RMF Faculty Association Office and Boardroom in Quezon City, Philippines, respectively, identified the proposal which zeroed in on the identification of a budgetary allocation for outsourcing of clinical, technical, and service support of the faculty and staff of the department for the provision of a working budget of 2 million yearly package deal in the delivery of such services, which will run between a 5-year to 7-year tripartite agreement period in the fulfillment of a 3-year traditional residency training program and the 4 to 5-year innovative residency training program in ITRMC, commences the idea of putting the people of the Ilocos region at the center of health and development, a manifestation of renewing primary healthcare system in the region, and this was further strengthened during the February 2 meeting at the DOH Central Office, together with Dr. Kenneth Virgilio, the Director of the Health Human Resource Development Bureau, and Doctorate Political Planning and Standards Division. The DOH, ITRMC, and FEU-NRMF entered into a consortium partnership to further strengthen the residency training program as well as to make it sustainable. Under this contract, each party has its own share to make in the furtherance of its commitment to attain the goals and objectives of the Universal Healthcare or Kalusugan Pangkalahatan. Administrative support will be shared by DOH and ITRMC, not to discount the fact that ITRMC has its existing infrastructure support for the establishment of this program. The FEU-NRMF, however, will provide relevant clinical, technical, and support services needed to sustain the training program. With the opening of the 11th residency training program in ITRMC, what we have in common is the doctrine of objective value. And all the time, April 1, such a tragic comedy of the date, we must decide to remove all doubts as equally non-rational, transform these sentiments for reasons to moving forward together. Together with the DCFM, we shall continue to clamor for those very qualities we rendered as healers, educators, healthcare managers, researchers, and social mobilizers. And together, we shall rise and need more drive, dynamism, self-sacrifice, creativity, and demand function. After all, we share one goal, and yet we shall place the Ilocos region in putting the Ilocanos, the Center for Health Development, by 2020, with the community and family medicine practitioners to be in the front line of primary healthcare renewal.